Hello, survivors. Some people has gone because they have flight or other tasks to do. Real life starts at 4 or 5 in many cases, and we have to conciliate. But we are just to finish in 5 or 6 minutes. Well, this is the closing table. In fact, I don't believe very much in having closing remarks because the symposium has been so linear in the sense that we have been able to follow the different presentations with the debates, and I'm so happy about the participation. I thank very much the presenters, but well, I just wanted to remark this and go on with my colleagues to close the symposium. Before giving the word to them, I wanted to thank all the speakers. Thank you very much for coming, for the effort, almost in Christmas, this is true. So even in Spain, after a long, atypical, non-typical week of 2 bank holidays and so on. So thank you very much, not only to the speakers, but also to all to the people attending the symposium and being active during the symposium. I believe that it has been a good choice to spend the full day here in L'Hospitalet in this room. And I also wanted to thank, of course, the people of the Tobacco Control Unit in the Catalan Institute of Oncology that have been working quite hard to have this symposium today, beginning with Mercè, that has been in charge of a lot of things, but not only her, I believe all the people in the unit. I will try to say all the names. Cristina, Anna, Laura, Esther, Laura, Olena, Montse, Yolanda, I'm missing. Tony, who has been doing pictures during all the symposium, and who else? And the other Cristina, who has gone because she had to go, and also Cristina Martinez, who has been involved in the preparation. So thank you very much to all of them, because it's a big team, a nice team, and a strong team. So thank you very much. I will get your applause to them too. Well, share with the speakers and yourselves. And I don't know whether I'm forgetting things, but in any case, I wanted just to finish to also acknowledge the collaboration of the Public Health Agency of Catalonia, who has been sponsoring part of the symposium, also the National Committee of Smoking Prevention, as well as the European Network for Smoking Prevention. Thank you to all of them, because their participation has been also crucial, covering parts of the symposium costs. Thank you very much also to the Catalan Institute of Oncology, where we are, and who has also been in charge of several of the costs of the organization. And that has been funded with money from these institutions, and also grants from the Tobacco Control Unit obtained from contracts with mainly with WHO, and without any other type of funding from tobacco industry, nor pharmaceutical industry, or other types of industries. So, and now I wanted to introduce you Dr. Carmen Cabezas. She's the Deputy Director of Health Promotion here at the Department of Health, the Regional Ministry of Health in Catalonia, who will be closing the symposium together with Dr. Germà, who is the Director of Knowledge and Research at the Catalan Institute of Oncology. So, Carmen?
Good afternoon. Only a few words. to explain our commitment as the Department of Health regarding the issues of prevention and control of tobacco. First of all, I would like to congratulate Dr. Fernández and his team here at the Catalan Institute of Oncology for not only for organizing this symposia, this third symposia, but also for all this work of the team during the year regarding to the prevention and control of tobacco, and also the research regarding these issues, and also in relationship with the coordination of the smoke-free hospitals network. This is very important here in Catalonia. And also I want to congratulate to the WHO Europe for the organization of the symposium and for all this wonderful work that was presented today, and all these things that we are waiting very much, the application that is under development, we need as people working in the health administration in order to show the importance still now of the problem of tobacco here in Catalonia, here in Spain. And also I would like to share with you the commitment of the government of Catalonia through the Secretary of Public Health and through the Department of Health. And this commitment involves different fields of work. For instance, we have been talking about the law. The law in Spain has supposed a big change, but there are the need to reinforce the law, the need to be aware of the new things that are coming, like the smoking in terrace. Somebody said before, and we are putting a special effort in the inspection of terraces. And also we are working, trying to decrease the initiation of smoking in young women and men and in teenagers. And we are working with the schools in order to decrease the prevalence there. And we are doing a good job because the prevalence has decreased in 50% in the last 10 years, and that is important, but we need to work very much in this aspect too. And also we are working together with the smoke-free hospitals network, but also with the smoke-free primary care centers that are all working together in a network, trying to offer help to all the people that live smoking in Catalonia. That is many people, but our figures are decreasing. But still now, 1 out of 4 people, 4 out of people smoke. And that's suppose 1.5 million people now in Catalonia. And we use very much this figure. We use this figure, and we use the fact that here in Catalonia, 10,000 people die every year for smoking, and that is very hard, and that's supposed 24 every day, 1 every hour, and we use that, and you use in media trying to put the emotional issue and the hard things about the smoking. And also, I try to explain also what are our challenges. And our challenges are to go forward in the legislation, because we have this problem, for instance, with children, with private spaces, and we are trying to go forward, trying to forbid the smoking in cars and in other private spaces, and in the outdoor space near the schools and in other places, and we are trying to make new legislation in these things. And also, we are far away of the 30% of the decrease that we need to do for the 2025. And for that, for us, is only to be in 20% of prevalence. That is terrible comparing with Australia, because it's 4 times the figure of Australia, but we need to make efforts in order to arrive to that. And also we have this problem with disadvantaged people, and we focus in disadvantaged people, and that is very important for us. And in our health plan, we are trying to focus in disadvantaged people, in women, and in young people, and so on. And I think that that are our challenges. I only want to finish congratulating all the presenters, all the attenders to the symposium, and looking forward for the next symposium this year. 2 years? 2 years?
Okay.
Okay.
Okay. Good afternoon, everybody. Just a few words to close the symposium, because you should be really tired after the long day. As a medical oncology, I was fighting against cancer for 40 years. In this period, I had been witness of many milestones in the curability of many cancers, like lymphomas, advanced testicular ovarian cancer, among others. But also, I have been seen the continuous failure increasing the curability of tobacco-related tumors. So, as an amateur writer, I published this year a book, entitled The 7 Pillars Against Cancer, with the priceless help of our epidemiology group. The point is to highlight the general population, the real value of cancer prevention for their lives. The chapter 4, the lectors can read the different measures of WHO FCTC treaty adopt. So also, the readers can read that if tomorrow the tobacco plant disappear, 27% of all solid tumors disappear as well. So I don't know other more efficacious measure to control cancer. So certainly today was a busy day for evaluating the results of the implementation of the treaty in the last 10 years. My main desire would be that you have found and achieved consensus on better and newer measures to decrease tobacco consumption. So to close the symposium, I just want to say that the Institut Catalan of Oncology has felt very proud to harbor the 3rd ICO-WHO symposium. So thank you very much for coming and for your active participation in this symposium. Thank you very much.